Welcome to our webcast. I'm David Folk Thomas. Now, you've heard the expression being on pins and needles. Well, what about having pins and needles on you? That's right, we're talking about acupuncture today. And as you may know, that's the practice of sticking tiny little needles into the body. We're going to find out what it's all about. And joining me, two experts on the subject. To my left is Dr. Ben Kliegler. He's the medical director of the New Beth Israel Center for Health and Healing in New York City. And sitting next to Dr. Kliegler is William Kaplanidis. He's a licensed acupuncturist and department head of allied arts at the Pacific College of Oriental Medicine here in New York City. And let's take a first-time patient who's been recommended here. Maybe they have a pinched nerve or some other problem, and they're coming to you for the first time. Take us through their treatment that you would administer.
A first visit, just in general, for me, might take an hour and a half to 2 hours. I'd have them fill out a medical intake form, very similar to the ones you might fill out when you go see a doctor, including a whole list of symptoms, which will help me get a picture of what's going on with the whole person, not just that one symptom that they're coming to me for. So after I review the paperwork, I'll ask them a series of questions. Oftentimes the questions might have to do with things like their bowel movements or if they're sweating at night, things that they may not understand how it's related to the pain in my low back, for example. But each point has many functions. So I'm trying to get a complete picture of the person to see what the cause of the problem is. Was it a car accident, or did they use up, for example, their kidney energy through stress and overworking, and now they have a weakness in their low back, physical weakness that's causing them to have pain. So once I would do the evaluation, I would have them lie down on the table, and I'd continue my evaluation by palpating their pulse, which would give me more information, looking at their tongue, which is sort of a map of what's going on inside of the body, maybe palpating their abdomen to see if there's tender spots. Again, each part of the body is like a map giving you information of what's going on inside. The Chinese didn't take blood tests 3,000 years ago. They looked at your eyes, they looked at your tongue, things they could observe. And then once I formulated an initial diagnosis of what I think was going on, I would choose points on the body. And depending on where the points were, they may have to roll up their pants or roll up their sleeve, or maybe I would drape them and they would take their pants off or something like that.
Do you do this on the first visit then?
Yeah,
Okay.
I include, for myself, I
Right.
include the intake, the evaluation, and the treatment in the first visit. Most practitioners do that. If it's a complicated case, the practitioner may opt to sit on it for a while, think about it, and then have them come back for the treatment. I would then explain to them, what's going to happen. I also do visualization and relaxation techniques for those patients who are really, really nervous.
So they can visualize that it will work and
No,
that.
not necessarily about the acupuncture, but just helping them relax their body, visualizing their muscles relax.
So people get worried about the needles.
Yeah.
Well, does it hurt? That's my next question.
In America, I think as children we get injections, vaccinations, blood drawn. Those needles are much thicker and they're hollow, so they actually tear your skin, and it's much more painful. An acupuncture needle is very thin, it's sterilized, and there's a range of gauges as far as the thinness. So some of them can be very hair thin, where it will, you won't even feel it going in. And I've put in 6 needles in a patient, and they've asked, so when are you going to put the first needle in? And 6 have already been put in, and they're...
How deep do you put them in?
Depends on the area of the body. You could go in 0.1 centimeter to ½ inch to 1 inch to 2 or 3 inches, depending on the area of the body. For example, the buttocks, you might go deeper, as opposed to on the chest area where you wouldn't want to go inward. You might just go under the skin.
And how long do you leave them in, and what patterns? How do you know where you go?
Okay. Depending on what the diagnosis is, you kind of look at the different systems. So, for example, the kidney energy, the liver energy, their functions. What functions are not working properly? Which organs or which systems are being affected? Then you would choose your points based on that. And you might use, 6 points to 10 points, depending. So anywhere from, 12 needles or 10 needles, depending on, how many points you want to use, depending on the condition of the patient. Then they would lie there in a relaxed position. You would put the needles in the points, and they would stay there maybe for 15 or 20 minutes. During that time, you may leave the room, or I stay in the room and I do other things like acupressure and gentle touch therapy just to move the energy and maybe put on some nice music and dim the lights. And usually the effect is very quick in terms of being very relaxed and comfortable while you're lying there.
Now, do people notice instantaneous results, or is it something that builds over a period of
It
time?
really varies on the condition. I've had situations where someone came in with an acute pain, like a back pain, a muscle spasm, and in one treatment, they were able to stand up straight, the spasm was gone, and then the follow-up treatment, it was completely gone, the tightness, etc.
I would say, I mean, usually people need more than one treatment.
Absolutely.
You know, that's
Absolutely.
one, I think, common misconception about acupuncture is that you're going to go once and you're going to be magically
Right.
cured. I mean, there are a lot of people, especially for acute problems, who will get a lot of benefit after the first time, but people should really expect probably that they're going
Right.
2, 3,
At least
4
usually,
times
yeah,
typically.
depending on the situation, I would tell my patients to expect maybe 3 or 4 visits just to see if there's any change in the condition, and then take it from there. Sometimes people may need to come for a series of treatments over several months, sometimes longer, depending on how chronic and what the state of their body is in. And then some people may just come for a shorter period of time.
And very quickly, is there any blood involved? Are people bleeding when you stick these things in needles?
Very rarely do you get blood after you needle someone. Occasionally you might hit a small capillary and there's a little dot of blood and it's gone. You just wipe it off.
All right, that's all the time we have now. I want to thank both of you, Dr. Ben Kliegler and William Kaplanidis, a licensed acupuncturist, for coming by and telling us all about what it means to have little needles stuck in you. Acupuncture has been our topic. Thanks for joining us on this webcast. I'm David Folk Thomas.